Hello and welcome! Today we're going to talk about a very important topic, especially for people who have kidney problems, fruits that should be avoided when you have kidney disease. You see, when your kidneys are not working properly, they can't remove certain minerals and wastes from the blood the way they used to. This means that even healthy foods, like fruits, can become harmful if they contain too much of something your body can't handle, like potassium, phosphorus, or fluids. Let's go through each fruit, one by one, and understand why they're not good for your kidneys. 1. Bananas are known to be rich in potassium, a mineral that helps your muscles and heart work properly. But for kidney patients, high potassium is dangerous. When the kidneys can't remove excess potassium, it builds up in the blood. And this can cause irregular heartbeat, muscle weakness, or even heart failure in serious cases. Just one medium banana can contain over 400 milligrams of potassium, and that adds up fast. So while bananas are healthy for many people, they are not safe for those on a low potassium diet. 2. Oranges and orange juice. Oranges are high in vitamin C, but they also contain a very large amount of potassium, just like bananas. For example, 1 cup of orange juice has nearly 500 milligrams of potassium. That's too much if your kidneys can't handle it. Also, orange juice is a liquid, and kidney patients often have to limit fluid intake to avoid swelling and high blood pressure. So if you're managing kidney disease, it's better to choose fruits with lower potassium levels, like apples or berries. 3. Avocados. Avocados are called superfoods because they are packed with healthy fats, fiber, and vitamins. But here's the problem. They have even more potassium than bananas. Just half an avocado can contain 500 to 600 milligrams of potassium, which is way too much for someone with kidney disease. Eating avocados regularly could cause a dangerous potassium overload, which puts the heart at serious risk. So as healthy as they are, avocados are not safe for most kidney patients. 4. Dried fruits, like raisins, prunes, apricots. These fruits start off healthy when fresh, but when they're dried, the nutrients become very concentrated. That means they have very high levels of potassium, sugar, and sometimes phosphorus. For example, just a small handful of dried apricots can have over 1,000 milligrams of potassium. That's double the amount in a banana. Also, many dried fruits have added preservatives that contain phosphate, which the kidneys also struggle to remove. It's best to avoid dried fruits completely and stick to fresh, low-potassium fruits instead. 5. Cantaloupe and honeydew melon. These melons are sweet and refreshing, but unfortunately, they are not safe for kidney patients either. Both cantaloupe and honeydew are high in potassium, about 400 to 500 milligrams per cup. If you're on a fluid-restricted diet, melons are also tricky because they're mostly water, and that adds to your fluid intake. Too much fluid can cause swelling in the legs, shortness of breath, and high blood pressure in kidney patients. That's why it's best to limit or avoid melons unless your doctor says otherwise. 6. Guava, or depending on the variety, guava is a tropical fruit that's rich in vitamin C, fiber, and antioxidants. Many people enjoy it for its sweet, tangy taste. But for people with kidney problems, guava may not be the best choice. Why? Guava contains a moderate to high amount of potassium, about 400 to 450 milligrams per fruit. If you eat more than one, it can easily push your potassium levels too high. Also, guava seeds are hard and fibrous, and in some cases, doctors advise kidney patients to avoid foods that can irritate the digestive system or cause constipation, which is common in people with kidney disease. So while guava is not the worst offender, it's a fruit that should be eaten in moderation or avoided altogether if you're on a low potassium diet. Check with your doctor if you're unsure, because even one guava a day may be too much for some patients. 7. Kiwi is another fruit that sounds healthy, and it is. It's loaded with vitamin C, vitamin K, and fiber. But like guava, kiwi is also high in potassium, about 215 to 250 milligrams per small fruit. That means eating 2 kiwis can give you over 500 milligrams of potassium, which can be risky if your kidneys can't remove it properly. Also, kiwi has oxalates, natural compounds that, in some people, can contribute to kidney stones or worsen mineral imbalance if kidney function is low. So, is kiwi always bad? Not necessarily. But for people with chronic kidney disease, dialysis patients, or anyone with high potassium in their blood, it's better to limit or avoid kiwi unless your dietitian gives the okay. And always follow your RENA diet plan or ask your healthcare provider if you're unsure. In nutshell, not everyone with kidney disease has the same dietary needs. Some people need to control potassium and phosphorus strictly, while others may not. That's why it's so important to talk to your doctor or renal dietitian before making changes to your diet. Thank you for joining me today. Taking care of your kidneys starts with knowing what to eat and what to avoid. Remember, not all healthy foods are healthy for everyone. If you found this information helpful, share it with your family or friends who may benefit too. And stay tuned for more kidney-friendly tips.